everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures par la ville face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we'll be hearing remarks from Mayor le Maire Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, Dr. Brent Mallockney, Associate Medical Officer of Health, médecin adjoint en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Available for questions from the media, following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dan Chénier, General Manager, Recreation, Cultural and Facility Services, Directeur Général des Loisirs, de la Culture et des Installations. After we hear from panelists, we will take questions from the media. Oh, sorry, just to add, we also have Clara Friere, Lead Human Needs Task Force, responsable groupe de travail sur les besoins humains. So we will now begin with remarks by Mayor Jim Watson.
Well, thank you very much, and bon après-midi, mesdames et messieurs. Good afternoon, ladies and gentlemen, and thank you for joining us for our regular media availability. As you see in today's world, compassion, respect, and understanding are essential. Comme vous le voyez dans le monde aujourd'hui, compassion et le respect et la compréhension sont essentiels. That's why we always mention kindness as a key measure during this pandemic. As Premier Ford mentioned in his press conference recently, we'll overcome this together as a community. Earlier this week, the Premier extended the province's state of emergency until June 30th. It's important to continue to proceed with caution and with the health and safety of everyone in our community as a priority. La santé et la sécurité des résidents d'Ottawa demeure notre priorité numéro un. That same respect and mindfulness should also be put out to practice when we go out of our homes and visiting parks and beaches. We've recently regained some more freedom to enjoy time outside the confines of our home, but to prevent the spread, protect others, and avoid a second wave, we need to be vigilant in practicing physical distancing, especially in our parks and beaches. This week, we've piloted physical distancing circles at Moomies Bay. These circles help provide guidance to park users, helping determine how to keep a safe distance from one another. You can simply enter your circle, lay down your blanket, or pop up your lawn chair and enjoy some outdoor time at Moomies Bay. Remember, when we visit our parks, we need to respect the park rules, and the water is not open, and we're not testing it, and there are no lifeguards. Rappelez-vous, lorsque nous visitons nos parcs, nous devons respecter les règles mises en place. We must continue to practice physical distancing in order to help protect ourselves, our family, our friends, and our community. On Monday, the Transit Commission approved OC Transpo's Transit Services Recovery Plan, an important part of our roadmap for the recovery phase of COVID-19. Transit services play a critical role in supporting our city's economic recovery by ensuring that residents can get to where they need to go across the city. Our transit ridership, as you all know, has decreased significantly since the outbreak of COVID-19 in our community. But slowly, as our economy starts to reopen, we can expect ridership to increase as well. Customers can be assured that health and safety measures will be in place prior to the increase in ridership, following recommendations of Ottawa Public Health. At our upcoming council meeting on June 10th, Steve Kanalakis, our city manager, will be presenting the city's recovery plan. Finally, I'd like to take this opportunity to acknowledge the great work of the United Way East Ontario and their Facing Forward initiative. Enfin, j'aimerais profiter de l'occasion pour souligner l'excellent travail de Centre-Est, Ontario, et leur initiative. The initiative, which was launched earlier today by United Way East Ontario, and with the support of the City of Ottawa and Ottawa Public Health, aims to provide cloth masks to the most vulnerable people in our community. This initiative provides workplaces, families, and other groups with a way to purchase masks for themselves, while at the same time providing masks for vulnerable residents in our community. Proceeds from the purchase of the masks will help provide masks for those most in need. I'm pleased to announce that the City of Ottawa will be purchasing 10,000 masks for city staff from the Facing Forward initiative. This is a wonderful way to support vulnerable people living in our community, such as those facing homelessness, isolated seniors, and people living in poverty. I want to thank very much the United Way for their support and encourage community members to consider purchasing masks through the Facing Forward initiative. For more information on this program, residents can visit www.unitedway.eo.ca/facing-forward. I would encourage you, because that's very complicated, just go to the United Way website. You'll probably get there a lot faster than me repeating that. I also want to thank our Human Needs Task Force for working with the United Way to help ensure that those who are most in need in our region are getting masks. Thank you. Merci beaucoup.
Thank you very much, Mr. Mayor. We will now be hearing from Chair Eglai.
Thank you very much, and good afternoon, everyone. There's no doubt that COVID-19 has affected everyone in our community in one way or another. Since the beginning of the pandemic, Ottawa Public Health has been aware and has worked hard to address the fact that racialized communities are disproportionately impacted by the virus. We know that these communities are not only more at risk to contract COVID-19, but also face prejudice, racism, and in some cases, verbal and physical assaults. This makes a difficult situation, nearly impossible for some community members. Racism is a significant public health issue, and Ottawa Public Health is committed to listening to and addressing the needs of our various communities. This includes our work collaborating with the city's anti-racism directorate with Councillor King, and congratulations, by the way, to Councillor King on his recent appointment, as well as our commitment to reconciliation and partnerships with our First Nations, Inuit, and Métis community members. Most importantly, we strive to listen actively in order to ensure that all voices in our community are heard and addressed. We're working hard at ensuring that health support is equitable and not reserved for certain populations. I'm sure that many are aware of certain changes the Mayor indicated approved at Monday's Transit Commission meeting relating to the use of cloth masks on transit. I'm proud of the input and collaboration between OC Transpo and the Ottawa Public Health. And I want to echo the messaging related to these changes. When ridership increases on trains and buses, physical distancing will become more difficult. Therefore, in order to help protect ourselves and others, we are promoting the widespread use of cloth masks while using our public transit system. This promotion will focus on educating people about the benefits of mask use and encouraging our community overall adoption of this added layer of protection when physical distancing is difficult or not possible. It is also important to remember that everyone is able to wear a cloth mask, that everyone is not able, rather, to wear a cloth mask because of age or health condition, and that as a community, we need to promote masks while ensuring that we are compassionate and helpful towards our fellow residents. We also working diligently at ensuring that everyone in our community is able to access a mask, regardless of income or personal situation. I truly believe that when we work together and support each other, we become stronger and are better able to thrive as a community. Thank you.
Thank you very much, Chair Eglai. We will now be hearing from Dr. Malakny.
Good afternoon. Recent events in the news involving racial violence have left many Ottawa residents and Canadians hurt, angry, and looking for answers. Much of the attention has focused on the United States, but with our proximity to the US and our own continuing issues with racism, this has led to protests across our nation as well. Racism is a public health issue, and Ottawa is not immune. Sadly, with the emergence of COVID-19, we have seen rising racism, xenophobia, discrimination, hate incidents, crimes targeting our Asian communities globally and here in Canada. Le racisme est un enjeu de santé publique et Ottawa n'en est pas à l'abri. La pandémie de COVID-19 a tristement entraîné une montée du racisme, de la xénophobie, de la discrimination, des incidents à caractère haineux et des délits à l'égard des communautés asiatiques, ici au Canada et dans le reste du monde. As a virus, COVID-19 does not discriminate. Anyone can be infected. However, evidence has shown that certain groups may be more impacted by COVID-19 than others due to broader health and social factors that increase the risk of contracting the disease and then being able to protect others. COVID-19 affects us all, but some people are facing incredibly difficult circumstances and hardships. Support, kindness, and compassion is what we need now. As an organization, Ottawa Public Health has been proactive in assessing how to better educate our staff on the issues related to racism regarding health and access to care. We are working with our city partners to confront and address systemic racism throughout our community. En tant qu'organisme, Santé publique Ottawa s'est employé à mieux sensibiliser ses employés à des questions liées au racisme en matière de santé et d'accès aux soins. SPO travaille avec ses partenaires municipaux afin de lever les barrières systématiques du racisme dans toute la communauté. Marches are taking place all over the world this week, including here in Ottawa. We understand that people want to gather to march and express themselves. If you are planning on joining the crowds to march this week, please do so responsibly by taking steps to keep yourself and other participants as safe as possible to reduce the risk of transmission. This includes maintaining physical distancing of at least 2 meters when possible, to wear a cloth mask at all times. Bring hand sanitizer with you and also wash your hands upon returning home. Avoid touching your face. Consider alternatives to yelling and shouting to avoid spreading droplets. Clean any materials that you carried during the march. And as always, while COVID is circulating in the community, monitor yourself for symptoms, and if any symptoms develop, get yourself tested right away. Now, if you're more susceptible to serious complications if you contract COVID-19, for example, if you're an older adult, have chronic diseases, or are immunocompromised, reconsider the need to be present in a large crowd and perhaps find a way to participate virtually. I would also add that if you have a vulnerable person in your household, you should also consider participating virtually. And if you are sick, please stay home. Last week, we launched the Ottawa COVID-19 dashboard to provide up-to-date information on core indicators for local monitoring and informing reopening decisions. This public dashboard, which is updated daily, will hopefully help residents better understand the situation and the impact of their actions. Each of us matter, and each of us will help determine the trajectory of the number of infections in our community and the opportunity for more businesses and settings to reopen. Now, of course, as more places open, it is easy to think the virus has gone away, but it does remain in our community. So whether you're in a public setting, indoors or outdoors, it is important to maintain physical distancing of at least 2 meters and wear a cloth mask when necessary. The more we start to gather in public again and have more contacts, the more mindful we must be of our actions as we learn to live with COVID-19 in our community. Avec le déconfinement et la réouverture des commerces et des espaces publics, réfléchissons aux actes que nous posons dans notre communauté alors que nous apprenons à vivre avec la COVID-19. So when outdoors, use caution, for example, when passing others. Sidestep, pass quickly and courteously, and or stagger yourself to not be directly behind others when walking, running, cycling, and other outdoor activities. When spending time with others, keep visits to outdoors, including your backyard or driveway, with people who are not part of your household. In indoor settings, use caution and routinely apply the principles of distancing, mask use, and washing your hands before and after activities, such as navigating using public transportation, including buses and taxis, grocery and retail shopping and farmers markets, attending medical appointments, ordering takeout food and curbside pickup, and allowing service providers in your home for renovations, cleaning, maintenance, and etc. For more information, view our Be COVID Wise, Understand Your Risks During COVID-19 poster for additional information about red, least safe options and green, safer options. Thank you.
Thank you, Dr. Malakny. We will now be hearing from Mr. DiMonte.
Good afternoon, everyone. Bon après-midi tout le monde. With summer fast approaching, we know that we must all prepare for a different kind of season as we adjust to comply with public health and safety requirements. One of these adjustments will be how we provide fun and safe summer camps to Ottawa families. This requires balancing fun with providing optimal safety for children and peace of mind for parents. Il nous fait trouver un juste équilibre entre le plaisir, une sécurité optimale pour les enfants et une tranquillité d'esprit pour les patients, et les parents plutôt. On Monday, we provided an update to announce the cancellation of the original summer camp programs planned to run this summer from June 29th to August 28th. In the coming days, we plan to announce a new summer camp program that will be designed to support and promote physical distancing guidelines and all provincial emergency orders. Full details on camps, including dates, locations, and registration, will be announced shortly. Tous les détails relatifs à ces camps, les dates, les emplacements et les inscriptions seront précisés bientôt. For now, if you currently have a child that was registered for a camp, the program will automatically be canceled, and you can visit ottawa.ca for details on credits to your accounts and reimbursements. This is also a time for the year when many residential and business property tax owners receive their final property tax bills. The due date for final payment is June 18th. La date limite du versement final est le 18 juin. As we mentioned over the course of this pandemic, the city has provided some tax relief for those property owners financially impacted by closures, furloughs, layoffs, and reduced business. With the city's property tax hardship deferral program, you can delay the full tax payment to October 30th. So far, 1,156 applications have been approved for the program. If you have been financially impacted and have not yet applied, it's not too late. Apply at ottawa.ca/tax relief. The deadline is July 31st. Vous pouvez présenter votre demande à l'adresse ottawa.ca/allègement impôt foncier sans accent. La date limite est le 31 juillet. And finally, to add to Mayor Watson's message of being mindful and respectful, we thank our residents who have been responsibly using our neighborhood parks. Overall, people have made a conscious effort to help stop the spread of COVID-19. Dans l'ensemble, les personnes ont fait un effort particulier pour freiner la propagation de la COVID-19. Today, we are announcing the reopening of washrooms at select popular park and beach locations. They include Andrew Hayden Park, Britannia Park, Westboro Beach, Moomies Bay Beach, and the Petrie Island beaches. The washroom facilities at these locations will undergo extensive cleaning as per Ottawa Public Health guidelines. We know we must be vigilant. While locally COVID-19 is showing promising trends, it is still a fragile situation. We still cannot gather with more than 5 people who live outside our immediate household, and we must continue to practice physical distancing. These gestures protect you, your neighbors, and your family. It's a selfless act that can save a life. Il s'agit d'un geste altruistique qui peut contribuer à sauver des vies. Also, if you choose to visit one of the destination parks like Moonies Bay or Britannia, be sure to keep a safe distance from others. If you see a large crowd at beach or destination park, please consider one of our other many parks and trails in the area. We want residents to enjoy our parks, time with your family, and the weather while remaining safe and healthy. Thank you. Merci beaucoup.
Thank you very much, Mr. DiMonte. I will now invite questions from each agency. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme. Vous pouvez poser une question et une question de suivi. We'll now start with Jason White at 1310 News.
Hi there. My question is for Mayor Watson about Friday's March Against Racism. I'm wondering if you've reflected on some of the reaction to your decision to join in, and whether you think it's still a good idea for you to participate, given that some people may not be happy to see you or the police chief there. And if you haven't reconsidered, I'm wondering if you could tell me a little bit more about why you think it's important for you to participate in this event.
Well, look, Jason, as I said to one of your colleagues earlier today, politicians are damned if you do, damned if you don't. If you don't go to the march, you don't care. If you do go to the march, it's for a photo op. I'm going as mayor. I'd have no formal role. I'll be marching. I will be doing my very best to respect physical distancing, wearing a mask, because I think it's important that we express our outrage at what happened in south of the border, but also recognize that we have racism and it's alive and well, unfortunately, here in our city and our country. Thank you.
Thank you.
Thank you, Jason. Do you have a follow-up?
No, I'm good for now. Thank you.
Thank you very much. Moving on to Sandra Abma at CBC. Sandra, a reminder to unmute your mic.
Okay, sorry. Can you hear me now?
Yes, we can hear you.
Okay, sorry about this. That's for Ottawa. This is for Ottawa Public Health. And the question is also about the march on Friday. And you've laid out some protocols you hope that people will follow, but we've certainly seen visuals of marches all over the world right now. And we see people very closely together. And I'm wondering what the concerns of Ottawa Public Health are about all these, about people coming together in a march, and what do you expect to see a spike of cases afterwards, or what are your main concerns about it?
Yeah, no, thank you for that question. I think that this is we live in unprecedented times. I mean, I think we've used that word multiple times to describe COVID. I think the situation in the U.S. and the emotions and feelings, and including anger that have been generated, makes it a really challenging situation. I think ultimately it's around individual decisions. What's furthermore is that these two things are interconnected, as we heard myself and other speakers talk about, that actually the issue of racism and marginalized populations are actually at increased risk of COVID and serious outcomes. So while we have almost two unprecedented events, they're actually interrelated, and so I think that ultimately, because this is such an important issue, I think it's up to individuals to make that decision about whether they attend or decide to participate in another way, say virtually. I think it's our role to provide guidance on how to participate as safe as possible. I would say that, what I've observed about the people of Ottawa in recent months is that people really want to do the right thing. They really are have been following the guidance with respect to distancing and increasingly with mask use. You see the recent actions by the Transit Commission to want people to be protected when they're using transit and making masks mandatory. So I'm thinking that in terms of providing the guidance for people in terms of how to navigate going out if they decide to join the march, to do so in as safe a manner as possible. And just like with other sort of reopenings that are occurring, which are giving opportunities for transmission, part of our job at OPH is to monitor trends and report that back to decision makers and the public and to the media in terms of what's going on in our city.
And just quickly to summarize, what are the main things that if someone wants to be part of that march and feels very strongly they should be there, what are the main things they should be doing?
Right. So the main things that people should be doing is trying to maintain distancing as much as possible. Ideally 2 meters, but 1 meter is better than no meters. Definitely be wearing a cloth mask. Bring some hand sanitizer with you to keep your hands clean. Consider the use of signage or drums or other things to make noise versus shouting or chanting, which tends to have droplets. Go further, and certainly if you happen to develop any symptoms in the next couple of weeks, then make sure that you get tested.
Sandra, if I can just jump in quickly. So one of the main things that public health is trying to do here is give people the tools to make an informed decision. I think Dr. Melaughney hit the nail on the head when he said it's a personal decision, but we want to make sure that people are able to make that decision having all the information in front of them. And so the advice that he's just provided, the guidelines that he's just suggested, and the potential outcomes I think people now have the tools they need to decide whether they want to participate or not participate and how they want to participate in the event on Friday.
Thank you.
Thank you very much. Moving on, we will go to CTV Ottawa, Ted Raymond.
Hello, my question is for Ottawa Public Health. You referred at the beginning of this availability to racism as a public health issue. I'm wondering if you could expand a little bit more upon what Ottawa Public Health is doing to combat that issue, specifically what concrete actions, are being taken.
Great, thank you for that question. So I think I'll divide my answer into internal and external. So internally, as I mentioned in my opening statement, we're working with our own staff to make people aware of the impacts of racism, of its occurrence, and how we want to behave as an organization and interact with members of the public. And I think in some ways modeling this, I mean, one of the things is we've started collecting race and other information in the work that we're doing. But before we embarked on that, we engaged members of the community to ask them, their impressions, to review the questions and how we were going to ask them. Once we're ready with our analysis and are ready to be able to provide results, we'll again want to engage members of the community to talk about how to do that in a thoughtful way, in a meaningful way, and a way that does not inadvertently increase stigma. And so I think that those are all good sort of public health principles of how to work in this space. And we are pleased to be interacting with various groups in the community through the Human Needs Task Force, through the Anti-Racism Initiative, and in other ways to assist with addressing the impacts of racism.
Sorry, and so externally, some actions you're taking. How are you working with members of the community in order to bring about positive changes, and also in terms of maybe COVID specifically, what impacts or what changes has Ottawa Public Health made to combat the impact of COVID on racialized communities?
Yeah, no, thank you for that. And I think it's an area that we're going to increasingly become involved with. Yesterday, a report from Public Health Ontario pointed to the higher rates of COVID and COVID deaths in neighborhoods across the province, mainly in urban areas that have higher ethnocultural populations. And so what we are wanting to do is have some conversations about, to better understand the experience of COVID by these populations and how we can be of assistance. I think it's a mistake to jump at a solution. I think it's very important to engage these groups, and we have been engaging them through Human Task Force, as I said, and other means. But I think going forward, especially considering the increasing evidence of a problem in this area and the interrelationship between COVID and racism and ethnocultural groups, that we want to be able to do more in partnership with these groups going forward.
Thank you.
Thank you very much. We will now go to Craig Lord at Global News.
Hi, I think this would be a question for public health. Have police been given any specific advice in advance of the protest regarding physical distancing and how they can most responsibly handle their presence at the protest?
Great, thanks for that question. I may not be aware of all of the communication between our staff and the police force, but I think that the general principles for COVID and the ways to protect yourself, they're no different. They're about distancing, they're about wearing masks, they're about hand hygiene, etc. And so those still apply. but I'm not aware of any direct communication.
Okay, and just a quick follow-up. Are you expecting to potentially see a spike in local COVID cases after the protest?
Yeah, good question. Hopefully not. Certainly, we look at the data every day, looking for a potential spike for whatever reason. We're also hoping that the instructions that we're providing people will be followed and will keep the participants as safe as possible.
Great, thank you very much.
Thank you. We will now go to Blair Crawford, our Ottawa citizen.
I guess this is a question probably for Parks, but you mentioned at the start of this conference about the circles at Moomies Bay. I'm just wondering if you've had a chance to assess if they've been affected and whether you're thinking you might expand it to other parks.
I believe my colleague,
thank you for the question.
I'm sure you could take that question.
Well, thank you for the question. Unfortunately, this week has not been as hot or as dry as the week when we painted the circles. So we have begun to assess them both through bylaw services and our ambassadors, but because of the rather sparse crowds, we're not getting a true feel for this. So we are still doing that. Maybe as the week comes to an end, we'll get a better idea of their effectiveness in more crowded situations. And we are looking at other potential sites to identify locations where we might.
Sorry, Dan, you cut out at the last part. Would you mind repeating?
Yeah, for sure. So we are also looking at.
You're very, sorry, I apologize. You're very muffled.
Very muffled? Is this better?
This is a little better, yes.
Okay. And we are looking at other locations, assessing other locations in terms of where we might place circles. If the Moomies Bay experience proves to be successful and we experience the same issues with distancing at the other sites.
Sorry, just to reiterate, you are looking at Moomies Bay?
We are assessing Moomies Bay for how the current circles are working. And we are also looking at the other beach parks, Britannia, West Road, places like that, Andrew Hayden Park, to see if they might be useful in those locations as well.
We can barely hear you, Dan. I think you have to get your microphone fixed for next time because it's frustrating not to hear you. You keep getting cut out.
Okay, so you're looking at other parks as well?
Yes.
Okay, thank you. Does that answer your question, Craig?
Yeah, it's Blair. It's fine and no follow-up.
Oh, sorry, Blair.
Okay, thanks.
Did you have a follow-up?
No follow-up, thank you.
Thank you very much, Blair. Nous allons maintenant aller à Julien Paquette, le droit.
Oui, bonjour. La question pour Dr. Melantin, and I'll repeat in English if needed. Je me demandais si on commençait à avoir une idée ou une orientation du taux de transmission depuis que le déconfinement est commencé. Est-ce qu'on commence à avoir des tendances se développer? Parce qu'on a entendu plusieurs reprises depuis le début de la semaine des propos où on souligne certaines inquiétudes. Donc, est-ce qu'il y a des tendances qui se dégagent jusqu'à maintenant?
Merci, Julien. And unfortunately, I didn't follow all of that. Could you just paraphrase that in English, please, or Kina to do that, please?
Sure, I'll do it. It's just the question basically is we've heard since the beginning of the week some statement of worrying about the evolution of the transmission of COVID since we've started to reopen a little bit. And I was just wondering if maybe it's too early for that, but if you've seen some tendencies and if we see some trends going.
Okay. Thank you, Julian. And my apologies for not being able to answer in French, and certainly communication staff at Ottawa Public Health can provide written answers in French if that would be helpful afterwards. In terms of of the question. As I said, I mean, certainly we're monitoring on a daily basis what we're seeing. We're putting the dashboard out. I would say that in the last period of days, as you indicate in your question, we are seeing a few cases in the community where we can't identify what the source is. It was not clear where they became infected. We are seeing a few hospitalizations. I think it's still too early to say what that means because the numbers can fluctuate from day to day. But certainly it's something that we're going to be keeping an eye on over the next several days and into next week in terms of if this begins to appear like anything of a trend. The other thing I would say, and just to remind, is that the cases that we see now reflect infections that pretty well happened almost 2 weeks ago. So it is kind of looking behind all the time. Hospitalizations even more so because it takes a little longer for people to become sick enough to require hospitalization. So I thank you for the question, and we're certainly keeping an eye on it, and we're going to see if this is just a little blip or it becomes part of a bigger trend going forward. And if so, then we would be providing more information and advice.
Parfait. Thank you, Dr. Malotny. La prochaine question, je ne sais pas si Monsieur le maire ou Monsieur Dimonté, vous êtes en mesure d'y répondre, mais c'est concernant la manifestation de vendredi. Bon, considérant que la loi provinciale en ce moment ne permet pas des rassemblements de plus de 5 personnes, je me demandais, dans le fond, si on sait à quel endroit la décision a été prise de permettre cette manifestation-là, finalement.
Je peux répondre, Monsieur le maire, si vous voulez.
Oui, certainement. Je vais donner quelques commentaires et Tony qui est responsable. La ville ne donnait pas un permis pour cette manifestation. Et certainement, on sait qu'il y a une manifestation et la police travaille avec la ville d'Ottawa pour améliorer la situation et Tony va expliquer ça.
Vous avez raison, Monsieur le maire. Essentiellement, on ne donne pas de permission, on ne donne pas de permis, quel que soit, parce qu'effectivement, selon la loi actuelle, c'est pas permise. Par contre, dans une société démocratique, les gens ont le droit de s'exprimer et c'est ce qu'ils vont faire. Notre rôle avec le service de police, c'est d'assurer que ça soit au niveau de sécurité publique, un événement qui n'a aucun incident. Donc, on a mobilisé nos équipes pour supporter la police. Fait qu'on va fermer les rues si nécessaire pour que ça soit passable, qu'il y ait assez de place pour les gens à une distance sociale, etc. Et on va essentiellement assurer que l'ensemble des événements, l'ensemble de la démonstration plutôt, se déroule sans éclos. Et c'est ça notre rôle. Il y a un de vos collègues qui m'a demandé si on va commencer à donner des tickets aux gens parce qu'il y a plus que 5 personnes. Absolument pas. Et ça ne serait pas la ville, ça serait la police dans ce cas-là parce que c'est sur la voie publique dans un événement, mais eux aussi. Là. Notre objectif, c'est d'assurer que l'événement se déroule sans problème et que la sécurité publique plutôt soit assurée.
Merci beaucoup. Moving on, we will go to Taylor Blewett at Ottawa Sun.
Hi, I think this question might have just been addressed in French, but I was wondering just about events such as Friday's March and others that have been happening in Ottawa or other places in Ontario. How does that fit with the rules around the max gathering size of 5 people? Has the province issued any instruction around, how bylaw should be responding to rallies or protests or marches of this nature?
I don't know if Mayor Watson wants to do a little introductory again. Mayor, would you like to, as we did in French, do an introductory, or do you want me to respond directly?
Go ahead. Go ahead.
Thank you. Well, as I just explained to one of your colleagues, so the city is not permitting this event. We're not giving a permit. We're not, sanctioning the event per se. Directly to your question, there was no direction from the province of Ontario with regard to that. We're in a state of emergency. Obviously, groups of 5 are not permitted. That said, there's a balance. We live in a democracy. People are expressing themselves of difficult events that we're living right now across North America in particular. And they're allowed to do that. So we won't be issuing tickets. Police won't be issuing tickets. Our simple role will be to assure public safety. We're working with police, so we'll ensure that roads are closed so people can walk and be a safe distance. And I would just echo what our colleague in public health said, the good doc, encourage people to listen to their guidance and wear a mask, stay a safe distance, and do all the other guidelines and recommendations that public health has. But our objective here is to ensure public safety, that they can express themselves in a democratic way, and there is no intervention that will be done with regards to stopping, but we're not either authorizing or sanctioning the event.
Thanks so much. And is there any concern that by, as you said, you're not permitting this, you're not specifically endorsing or authorizing or anything, but that it will set a precedent for future large gatherings or other organizations coming and saying, there was an intervention here, we want to do a similar thing? Is there any concern on the part of the city about that?
Well, I certainly would hope not. I think, as was mentioned by other speakers, we kind of live in very exceptional times, not only COVID, but the events that have been happening, and people want to express themselves. All these events, take out the current events that are going on right now, these type of events, particularly in the nation capital, happen regularly where people come and protest. So for us, that's just the public safety, keep the peace and ensure everyone is safe, and it can be done in a safe manner. But directly to your question, I would hope not. I think this is a very exceptional circumstance. And I think we're hearing from our public health officials, there is some risk to this. So I would encourage people not become the norm, and that every weekend we would have these types of marches. I think this is very exceptional, and there's good guidance from public health. We're going to ensure that it can be done in a safe manner with Ottawa Police. And I would encourage people not to do this on a regular basis until we've resolved this COVID threat that we have.
Great, thank you.
Thank you very much. Pour finir, nous allons à Jérémy Bergeron, Radio-Canada.
Le dernier, mais non le moindre. La question, c'est pour Monsieur le maire, Monsieur Watson. Est-ce que vous encouragez les résidents à se présenter vendredi à la manifestation? Si oui, est-ce que c'est pas un peu dangereux d'un point de vue de santé publique?
Non, c'est la responsabilité de chaque personne de déterminer oui ou non de participer à la manifestation. Les organisateurs m'invitent il y a quelques jours et je dis oui, mais c'est une décision personnelle pour les membres de la communauté. Merci.
Avez-vous une question?
Merci. Oui, mais en fait, une précision, peut-être a precision for public health. In the new report, we can see there's 247 deaths, and yesterday it was 248. So do we know why there's one less death?
Doctor, I don't think you're familiar. I saw a note on that. The individual who passed away was not a resident of Ottawa, so that brought the number down by one. La personne qui... Tu comprends? Oui. Merci.
Thanks, Mayor.
Est-ce que ça répond à votre question, Jérémy?
Oui, merci beaucoup.
Merci pour ta patience. Thank you to everyone. This is all the time that we have today. Merci de vous joindre à nous et bonne fin de journée.